When it comes to motherhood, we often discuss what to do when raising the child, but prenatal and postpartum care is crucial to the well-being of the mother. Joining us now to talk more about prenatal and postpartum care is Dr. Broshears, Medical Director for Anthem Medicaid. Thanks for being with me.
Hi, thanks for having me.
So why is caring for the mother before and after the pregnancy so important?
Well, you know, we live in a country where there's just an enormous amount of healthcare resources, but we still have 700 deaths of women who have, either during pregnancy or after birth in this country every year. And in Kentucky, actually, in 2018, there were 76 women who died from those pre or postnatal complications. So, right here in Kentucky, we have, almost a tenth of the deaths, in this country. So we definitely need to do something about it. About 1 in 4 pregnancies will have some sort of complication, either right before or after in that year following. And so we found that up to 2/3 of those complications and deaths can be prevented with appropriate prenatal and postnatal care, as well as doing just general healthy things for our mothers and teaching them about those things.
Yeah, and what can people expect during a prenatal visit?
So, people get worried about going to the doctor, but those prenatal visits are generally pretty, easy, not a lot of stress. So, going and you're going to get weighed, you're going to leave a urine sample, you're going to get an exam. As the pregnancy goes on, there may be some lab tests and some ultrasounds, but typically, moms don't, have to worry about getting poked and prodded too much. But that's an excellent time for moms to bring up questions. And nothing silly, anything, if they don't feel right, they're worried about the delivery, what's their birth plan. I really encourage moms, to talk to their doctors about their options and what they can do. And, that little silly thing may be not, that may be a big deal, and that could really make a difference in the health of themselves as well as their baby if they just bring it up.
Yeah, and why should women, that's on the prenatal side, but why should women get help even for postpartum?
Okay. So postpartum visits are really important. Even if you're feeling well, your doctor has the opportunity to talk to you things such as, one, how are you feeling? We really want to focus on whole health, physical and emotional. It's a stressful time, there's hormone changes. So are you having anxiety? Are you having depression? Are you still bleeding from your delivery? Are you having urinary issues, constipation issues, sleep issues? No mom is going to be getting a lot of sleep right after birth, but sometimes, there's more to it than that. So definitely talking to your doctor. Talk to your doctor about, future reproductive plans. Do you want to have more kids? And they can help you make those decisions. So, again, I can't emphasize enough, really talk to your doctor or your healthcare provider about anything that's bothering you or worrying you at that time, because they're there to talk to you. Sometimes, women think, oh, I feel healthy. Well, there's so much more, and they may not see it. And then, there's lots of going on. You got baby at home. You think, I'm gonna prioritize the baby's health, not mine. I really encourage them, because by helping themselves, they're really helping their children.
Yeah, so they need to make sure to prioritize the well-being of yourself. That way they can help their baby.
Definitely.
All right, well, thank you so much, Dr. Broshears. We'll be back with more Everyday Kentucky. Keep it right here, and we'll be back with more right after this.